Hi, my name is Jackie Hall, and I'm doing my presentation on syphilis with an emphasis on antibiotic resistance. What is syphilis? Syphilis is a sexually transmitted disease caused by the bacteria T. pallidum. In the late 1990s, people thought syphilis had disappeared. Years later, this stealth pathogen reemerged as a public health problem. The World Health Organization estimates 7 million new syphilis cases in 2020. Understanding how syphilis is diagnosed. There is two types of tests. The non-treponema tests. These tests are the most common used as they are said to be the easiest and the most cost-effective. However, they are not sensitive and they can miss a diagnosis due to the test's inability to pick up lower stages of syphilis. The treponema tests, however, have detection of more sensitive antibodies. The problem with this is it is more expensive and it is difficult, if not impossible, to distinguish between active stages and previously treated infections. Knowledge about the prevention and treatment of syphilis is especially important nowadays. Why? Because recent data shows that syphilis rates are on the rise. You need to be diligent. Talk to your doctor. Have an honest and open talk with your healthcare provider about your sexual history and ask to be tested for syphilis and other STDs when thought of exposure. Many men don't have symptoms, so testing is the only way to be sure that you do not have syphilis. If you are HIV negative and have syphilis, make sure to ask your healthcare provider about different options for treatment. Protect yourself and protect your partner. If you are sexually active, doing the following can lower your chances of getting syphilis. Being in a long-term, mutually monogamous relationship with a partner who has tested and has negative STD results, or using latex condom the right way every time you have sex. If you have sex with more than one partner, don't use condoms, or are engaging in risky sexual behaviors, then you should get tested more frequently, an example every 3 to 6 months. Increases in the number and rates of the disease have been notable over the last decade, but rising cases in newborns have renewed attention to the crisis. As clinicians race to stem the spread, population trends suggest that many Americans of color living with the disease aren't getting treated for it. Untreated syphilis may lead to meningitis, neurological problems, hearing loss, and in some cases even death. Syphilis is also an issue as it increases likelihood of miscarriages and premature births. Reported cases of primary and secondary syphilis surged by 38% between 2019 and 2021, according to CDC data. These cases are also seen in our more vulnerable populations, such as pregnant women and those of bisexual or MSN type relationships. This is showing our missed opportunities for preventing congenital syphilis in 2021. The main cause, 41%, was no timely prenatal care and no timely syphilis testing. Many factors are causing the increased trends in syphilis, such as lack of insurance coverage, unstable living circumstances, sexual practices, drug use, and drug resistance. Syphilis is caused by a bacteria and is generally curable by antibiotics. However, these STIs go undiagnosed and are becoming more difficult to treat, with some antibiotics now failing because of misuse and overuse. It is recommended that syphilis needs to be treated with the right antibiotic at the right time and to monitor patterns of spread of this disease. This chart shows resistance to antibiotics and how that occurs. With the exposure to bacteria, the bacteria multiply, the infection occurs, and the bacteria spread. The drug for treatment is used, the bacteria die, the person is healthy again. Here it shows the drug-resistant bacteria, the bacteria multiplied, the bacteria continue to spread, and the person remains sick. Over here, it shows how it only takes one mutated DNA in the bacteria to show multiplied, and it overtakes the resistance of the drug, and the person remains sick. This is causing a lot of issues in the treatment moving forward and shows a lot of room for improvement and opportunity for different types of treatment. Thank you for listening to my presentation, and I hope you all have a great day.